I'm Dr. Nanda Rajaneesh. I'm laparoscopic surgeon and oncosurgeon. I like to speak to you on piles and fissures in women. We all know women really suffer very often from piles and fissures because this problem is, one, it is lifestyle related. Second, it can come for all humans because we pass motion straight. Third, women getting pregnant, they press on the rectum and the blood pressure over there increases. And fourthly, women do not eat food on time and they depend a lot on taking care of others and not themselves. So this causes very commonly piles and fissures. The most common reason is eating less fiber food and eating less fruits and vegetables. What happens, women focus on the families and the relatives and the husband and children. They give all the fruits to them and vegetables to them. They themselves are bored to cut it for themselves. So that needs to change. Imagine if you don't want to suffer from any health problem, it is important that you take care of yourself. Because there is a difference between what is piles and what is fissure. Piles is a rectal mass that comes out, rectal mucosa with a lot of blood vessels. It starts prolapsing out, which is more common during pregnancy and also for sports people, those who are doing gymming and not drinking enough water, lifestyle and heredity. These are the factors that cause piles. Whereas fissure is a cut that comes because of purely heart motion, not drinking enough water, and sometimes fissure, multiple cuts can come due to food intolerance and certain associated inflammatory bowel diseases and irritable bowel syndrome. So when a women come to us with any anal problem, it is very important, please go to doctor as soon as you have anal problem. Do not neglect, because progressively you can develop thrombosed hemorrhoids, this complicated hemorrhoid becomes an emergency surgery, or you can develop a fissure with an abscess pus pocket, and that abscess can lead to fistula in ano. So this is a reason progressively you can develop multiple problems. So how to prevent fissure in ano, as I said, or the anal piles problem, as I said, if it is due to pregnancy, we don't have much choice. But if you have a problem before pregnancy, please go to the doctor before you plan pregnancy and meet and get it sorted out and then get pregnant. One. If you get problem during pregnancy, we have to manage you conservatively. A lot of times, piles patients have to be bedridden for some times. Fissure can be just managed with a diet and ointments initially and probiotics to prevent infection in that area. During pregnancy, it can be managed for 9 months. Post delivery, we plan a surgery if it is needed. But still, it is very uncomfortable because you have a baby, and undergoing surgery at that time it's not very comfortable. This is the reason pre-pregnancy, again I tell you, if you have anal piles and fissure problem, meet the doctor once. Let her decide whether surgery is really needed or can we conservatively change things for you. And diet is very important. Have a good antioxidant diet, lot of colored fruits and vegetables, very very important, and drink lots and lots of water and fruit juice. Go on more of a liquid food than the solid food, which is very very helpful. So I like to suggest, eat well, sleep well, have a good happy life and good exercise with a good bowel movements. You can prevent piles and fissures. Thank you.